Hello, I'm your host, Dr. Sonia Johnson. Waiting on some people to join us. If you want to share this screen, just press the button at the bottom of the screen. As you know, sharing is caring. And if you have a friend that you want to share this message with, just tag them. Okay. Hope you had a wonderful day today. It's very cold here. I'm in Indianapolis, but it's nice. It's the Four Seasons. Okay. So welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So I've been talking about procedures for the last couple of days. And so today I'm going to talk about what happens when you have a bad outcome. So what now? For chemical peels, especially, as you know, from a previous lecture, I mentioned chemical peel is an acid that we put on the face or anywhere on the body, really. I mean, you can use it on your hands, back, legs, wherever you want to try to exfoliate the skin. And you leave it on for a period of time, depending on which chemical peel you use and how deep it can penetrate the pores. You will leave it on for a certain period of time, and then you rinse it off. Okay. A lot of times water neutralizes it. And you want to make sure you keep rinsing it off until you feel nothing and wait for a period of time. And if you start to burn again, you want to start rinsing. That means you still have some chemical remaining on your skin. So what if, it stays on longer than usual, or the percentage that was applied, it was actually too strong for you? Or like some people, you're actually using a retinoid or some type of exfoliator at home, and then you go to the salon and you get, or spa, you get a chemical peel without reminding them that you're using something at home. And so therefore the strength that you should be able to tolerate, now you can't tolerate it because you've been exfoliating your skin and you don't have much dead skin for this chemical peel to take off, and therefore it's actually burning your skin. So those are some examples of how people end up with burns. And of course, my favorite is you do an at-home treatment. You're not really for sure what to do or how to do it. And of course, you're thinking, if I use a stronger acid or I leave it on longer, it's going to work much better. And that's so far from the truth. Okay. So in some cases, it's best to pay more and just go see a professional. Especially in this case, if you've never done a chemical peel at home before, you want to do that. So with chemical peels, you want to start off mild, right? And you want to work your way up to what you can tolerate and definitely increase the time duration depending on the chemical peel. But a professional will know that. So if you have a bad outcome, the worst case scenario is, you have a chemical burn. This is a chemical. And like I said, stay on the skin too long, it will cause a chemical burn. The problem is, as days go on, if you're not treated appropriately, you can get an infection, heaven forbid, the scarring or the discoloration that can occur from this product. So sulfasalazine is what we use for this, and you put it on as indicated by the doctor. But even after you treat it, you will have side effects. Okay, you're going to have some negative outcome, and one is discoloration. But as you go through that process, something acute as a chemical burn, or you may not have a chemical burn. You may end up with just an irritant dermatitis. You rinsed it off fast enough where it wasn't as strong, but you removed it from your skin before it caused serious problems. And with the irritant dermatitis, my favorite is steroid creams. The ones over the counter, you can try that until you get to a doctor. But my favorite is a stronger steroid cream and more of an ointment than a cream, because the creams have preservatives in it that will help to keep that cream on the shelf for a long period of time. But if you use an ointment, there's nothing in it. You don't have to worry about, the shelf life. Nothing grows in ointments. So an ointment is better. It's soothing, and it would definitely turn off any reaction that you have. Aside from that, as the time goes on, you would notice that the burning, the tightness is not a factor. And like I said, using either product, my favorite is the triamcinolone, is the ointments or steroid ointments. You would notice that your pigment, you're going to lose pigment, but it would come back. That's the beautiful nature of the body, that we do heal well. Just need time. So for some people may get lighter if they have a discoloration that is lighter, like a light spot. That I like this again, the steroid creams for that, and give it time, or cocoa butter once it has healed. But if you end up with a darker spot, which is really common, then you need to do something different. So for majority of people, they may just go with a bleaching cream and give it time again. Or you can actually go back to the chemical peel. This is where the professional comes in at, though. In my office, you can reverse it, the discoloration, because it's gonna, you can do it faster with the chemical peel if you have discoloration. However, you come in really low, the lowest strength you possibly can, and sometimes we even dilute ours out even more to offset the discoloration that someone had reaction to from doing something at home. And we just continue to do what we do well. Use the the chemical peel, leave it on for a couple of minutes, rinse it off, but you come in very low, and it's going to take a long time, but it does it really nicely. So again, when you have a bad outcome, chemical burn is the most severe one. That's where you want to really rinse the product off and go right to the hospital or the doctor's office and get something. Next worst is the irritant dermatitis from a chemical peel. And also after you get over the acute phase of it, there's the discoloration or the light spots you have to deal with. And some people even still notice the changes in their texture of their skin, sensitivity. And usually that does resolve. I don't remember anyone ever or reading about anybody having persistent sensitivity issues from chemical peel. That's, that the products that we use for chemical pills. And like I said, the coloration that you have, that does take time to resolve, but it can resolve. And so just keep that in mind, that some things you do want to see a professional for, and this is one of them. But any questions? Okay, so hopefully you won't have that problem. And thank you, and I'll be talking to you tomorrow. Again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the gorgeous RX system. I have women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. We have products that, if you're interested in, go to GRxSystem.com, GRGEOUS.RX.com. Or if you want some free gifts, go to GorgeousSkinNow.com. Have a wonderful evening. Take care.